As kids return to the classroom, we know it's likely that more cases of the flu and COVID will return too. Every fall, an updated flu shot is released, but this year, medical experts say we'll also have an updated COVID booster. Johns Hopkins Medicine Associate Professor of Pathology Heba Mustafa says the flu shot and COVID booster will be two separate shots. The new COVID booster formula is based on the XBB variant that mutated from the Omicron variant and has been circulating for the past 6 months. But there's a new variant catching scientists' attention. Mustafa says it's closely related to the XBB variants, and therefore the new booster will give us better protection than the original vaccinations. She says that's why it's so important to get updated boosters.
Vaccinations have actually helped reduce the severity of the infection, and they developed that baseline immunity, but also boosting the immune system with those booster doses will actually become very helpful in maintaining that resistance and antibody levels, so we can try to reduce the spread of those new variants and make sure that a lot more people are protected, especially those vulnerable populations.
When looking at the evolution of the SARS-CoV-2 virus and waves of infections, Mustafa says there's enough evidence to show how effective boosters can be to reduce the spread and prevent serious infection.
1 in 3 women and 1 in 2 men will be diagnosed with cancer in their lifetime, according to the American Cancer Society. And a recent study finds certain kinds of cancer are being diagnosed more often in younger adults. In today's Health Minute, Mandy Gaither takes a look at the research and the two groups of people most affected by the rise in cancer diagnosis rates.
Women and adults in their 30s seem to be driving a rise in early onset cancer diagnosis rates.
Just to get the definition straight, if a cancer is diagnosed before the age of 50, it's considered an early onset diagnosis.
In a study published in JAMA Network Open, researchers found the rate of cancer diagnosis rose in adults in their 30s from 2010 to 2019, but remained stable over that period in other under 50 age groups, while the rate of cancer in those 50 and older is going down.
If you go back to 2010, there was roughly 100 per 100,000 diagnoses made in that population of people, again, under the age of 50. Fast forward 10 years and it's gone up to close to 103, so about a 3% increase.
Researchers found early onset cancers were going up fastest among people who identify as American Indian, Alaska Natives, Asians, and Hispanics. Cancers with the highest number of early onset cases diagnosed in 2019 were breast, thyroid, and colorectal cancers.
The percentage of the country that is obese at this young age now is higher than it's ever been.
Health experts believe that's one possible reason for the rise, along with smoking and lack of exercise. Researchers also think screening for these cancers has become more sensitive.
We are better at finding these cancers earlier. The screenings are happening, or they're more sensitive, so we may be finding more cancers that way.
For Health Minute, I'm Mandy Gaither.